Hi, I'm Shannon Pace-Brinker with the Academy of Chairside Assisting, and our module today is going to be PVS impression techniques. What are we going to learn today? Well, there's a couple of areas that we're going to touch on. We're going to talk about various types of impression material, but most importantly, the viscosities, understanding why we're using this product for this type of procedure to have you understand exactly what choices that we have when it comes to those impression techniques. We're also going to talk about patient positioning. We're going to go through what are the things that we're going to say to those patients. We're going to talk about impression trays. We're going to go through, whether it's a preoperative impression. We're going to talk about the final impression, hemostasis, controlling any type of fluids that the patient may have, and how do we get a really good final impression. And then the last part is probably my favorite and the most important is how do we look at these areas that are bad in impression. As a team member, we just really sometimes are not made aware of the mistakes that we've made. And also even for the doctor, taking a final impression. So we want to make sure that you understand how it happened and what can we do to correct that in the future. I also want to just start by just mentioning the fact that this educational module has really received a grant on behalf of Culzer, and I want to thank Culzer for supporting us, and Contemporary Product Solutions for also giving us the credits today to really promote and show you the empowerment of taking a really good impression and what the impact will have on your practice. There are a lot of variety of impression materials out there on the market today, and making it a challenge to select the right ones. But I will tell you that there's so many different types, viscosities, and materials that it's really important for you to understand what it is that you needed and the procedure that that type of impression material is going to dictate. The overwhelming number of options can lead to confusion and inconsistency, which keeps dentists from achieving those successful outcomes. Gordon Christensen said that 40 million impressions are taken every year. Yes, 40 million. Wow, that's a lot of impression material. But 90%, and this is what makes me sad, and we've seen it, 90% do not have all the margins that are taken. And so it's easy for us, I think, sometimes to blame things on the lab, but I can tell you, you're only going to get back what you give. And I love technicians. I work a lot with laboratory technicians, and it's really important because they'll share with me some really bad impressions, and I've seen a lot out there, and we're going to share some of those bad ones at the end of this module today. But if you don't know why these things happen and you don't understand how we can correct them, you're going to continue to have bad impressions. And most of the time, it's the operator, not the product. Mastering the art of impressions really, to understand that, you got to understand what is ideal. And I will tell you that I never really had anybody to tell me, hey, that's bad and this is why. And so this has really been our focus, really for the dental assistant, because we take a lot of impressions and dental assistants really don't know even what they're really looking for or what they're looking at. We don't want any folds or wrinkles in the material. We also don't want any voids, bubbles. We don't want to look at any type of discrepancy in the margins. A lot of times what we see is, the impression tray may be too short and we didn't have enough extension or not enough material. And we want to make sure that we're looking at all the occlusal surfaces and that we see good margins around every tooth. There's also, let's talk about dispensers. If you're going to take a lot of impressions and you know that you're doing that already in your practice, the best way to cut down on the price and the product that we're using and to be able to take more impressions is to maybe switch from what we call our conventional gun to our bigger machines that will hold these cartridges that allow us to take a lot more impressions than we would if we were using the cartridge or using the putty in a tub. So just kind of think about that and how many impressions are you taking, and double check what that fee may be, because it's really important to think about it. I'm going to get more bang for my buck if I use a larger machine and not just the cartridges. The other thing is thinking about the type of trays. We can't just say we're going to use one tray. We have to have various types of trays that we're going to utilize for various areas of the mouth, and also thinking about, do we need a triple tray here? Do we need a quadrant? Do we need a full arch, and why? Because a lot of times what we'll find is if we're prepping more than 3 teeth, even some people still will use a quadrant, but the lab needs to see the other side of the arch. And so thinking about, and really talking to your assistant, or even the assistant talking to the doctor, is, tell me the procedures that we do that you want me to take a full arch impression, or when you would take a full arch versus a quadrant impression, and making sure that you're choosing good quality impression trays. The first thing that we want to talk about is alginate. Now, I am not a fan of alginate, I will tell you. I will take alginate and the teeth are flapping in the wind, and I know I might do an extraction that is a no charge to the patient, but I'm not a fan of alginate. And the reason that I don't really care for it is because after 20 minutes, it gets distorted. If I'm going to take an alginate, I want one that I can have time to pour it and it's not going to be distorted, but I can tell you that there's very few of those out there. And I love the fact that I can have a polyvinyl, not an alginate. We do call these alginate substitutes, but it's a polyvinyl because it can be poured more than one time. It can sit on a shelf for several weeks. And if I have a patient that's in provisionals and they lose one or they break one, what am I going to do? But if I've got a polyvinyl preoperative impression, I place it in a bag, I put the patient's name on it, and I've got something to go back to. The other thing is, I always tell patients I'm going to take a series of impressions, because this way if I had to take more, I can, but I'll tell you a lot of times these polyvinyls that are out there, especially this one, they take really good impressions. And it's really great for me to be able to send that to the lab, and guess what? The lab can pour it. Not me. And so the lab actually prefers to pour it because they want to use it in their own stone. I don't have to worry about them calling me and saying, Shannon, I'm sorry, but I dropped the impression. I need you to get the patient back in. Or, there's lots of things that can happen in transit. So I like to take it and let them do it, and it's a short period of time. And we know that polyvinyl does not have the distortion the way we see it in alginate. And so we've got a lot of studies out there with that internal dimensional stability study that was done, where we look at that shrinkage of material with the alginate versus a polyvinyl. And it makes sense because it's made of alginate. It's going to, or algae, it's going to shrink, and it's got water in it. So you think about algae and water, it's very different than polyvinyls. So we want that stability. So let's go to our video real quick and let's show you how we take these. And I'm going to take my impression, and I want you to just really relax your lips, and I'm just going to kind of just push that up, and I want you to bring your lips over that tray for me, and I'm going to come right around, and notice where I'm holding that tray. I'm right in the premolar area. I'm going to be holding that. I'm also able to really look down and make sure that that tray handle is in line with her midline. This material is basically a 1 minute working time and a 1 minute 30-second fully set. So it's been a minute and a half. I'm just going to double check. I'm going to my timer's gone off, but I also want to just make sure when I rip it or when I pull it apart that it rips really nice and clean. That's kind of my second way to check the impression material. So I'm going to take my finger and just kind of lift up her lip just a little bit and get a nice little rock out of it. And I'm going to pull this. And what I want to show you is my impression. So now we're going to go ahead and we're going to take an impression on the lower. And notice a couple of things. I'm not lifting my tip. I want to make sure that I keep this tip right into this material. I also want to make sure that I'm going to make enough of an area where we've got plenty coming through. And notice where my fingers are here. I've really got good control right on top of the premolar area. I'm not going to hold it in front of the handle. And I also have my hands underneath the chin just to kind of help it from kind of, sponging up, or I say lifting a little bit. So I've got really good control. See, a lot of assistants will stand in front the whole time, and that's fine because if you're worried about moving, you can move the tray. But for me, I like it better where I can put my hands around her chin and actually hold it stable here. So again, I think it's just a matter of technique. But this is going to be a minute working time, minute and a half setting time. The other materials that they have is another type. It could be either a putty or it could be in a heavy tray cartridge. There's a lot of different options that you have in your practice. But what I love about these impressions is that when we think about final impression material that takes as little as 30 seconds of working time, and then also routine cases that we're doing on full arches, things like that, we want to really look at the setting times. And it can be anywhere from 2.5 minutes to 3 minutes. And that's actually all we need, because a lot of times we say in dentistry, wow, this takes too long, So the beauty of the products that we like to use, really when we place it in the mouth and the warmth of the body is going to accelerate that setting time to get us to where we need to be. The other thing is that we want to think about our bite registration materials. And this is a great bite registration material. This is called the VPS Bite. It is by Kulzer. But one of the things when we think about a proper bite is that we want to look at how we're taking it. And now what we do is we actually will utilize a bite registration to capture all the dentition, the patient's biting all the way together, so we know exactly how those teeth come together. And the way that we do this is a little bit different than probably what you've seen before. We'll take the impression, but we're going to start on the maxillary arch. And I learned this from a really good friend of mine, Dr. Cappy Sinclair. He said to me, Shannon, you know, if you take the maxillary impression for the bite or maxillary bite, place that material, start on the last molar and go to the midline, last molar and go to the midline. But again, it's different. Do it on the maxillary arch and have the patient bite together. You won't have as many discrepancies as you would have if you would have placed it on the lower arch. And I'll tell you, seeing is believing. I wanted to be proven, right? But I can tell you that he was right. The patient was able to bite right into this and really get a really good bite. And let me show you this, because what makes a good bite is when we can take it out of the mouth of its set, hold it up to the light, and you want to see these little areas where the patient has bitten through it. If it's solid all the way around, you did not get a good bite, and it tells you the patient did not bite down all the way. So we need to see those little see-through areas. So sometimes when they come out, I'll hold it up at the light and I'll look through it to make sure that I can tell where the patient has bitten together. Impression techniques. I talked about a little bit as we were taking the impressions. This is really important, is to make sure the positioning of where you are. My chair is all the way to the ground always, because I want to be higher than the patient. So when I seat the impression, I can come around them with their face towards you, and I can really see up and over where the handle is. That handle, and I've learned this from lab technicians, I cannot take the credit from this. Buddy Schaefer, who has spent a lot of time with at Bayview Dental Lab, said, Shannon, you always want that handle lined up with the midline. I told you I spent a lot of time over at Invisalign teaching a lot of Invisalign courses, and I had the pleasure of getting to see how, when we ship our impressions, the way that the impression material is scanned in the machine, and that handle goes right into the machine, and it's lined up with the patient's midline. So we really need to see up and over. So we're going to insert that tray like we talked about and come straight up. But notice that where the position is, I'm going to walk around, place it in the patient's mouth, and I'm sitting right over it, and I want to look up and over. If you see it and you notice that the handle, it might be over a little bit, whether to the right or the left, you're not going to take that impression and just move it. You need to keep it where it is, because if you move it after you've already seated it, you're going to see that what will happen is that the patient will have a drag in that impression, and that impression will basically be one that you'll have to toss. You're going to have to retake it. Same for the lower. Getting it in, always insert the tray straight up or straight down, and I can't say that enough. Don't touch the teeth. Never ask the patient to hold this tray. There have been times where I've seen assistants tell the patient to take their hands and hold the tray in place. Patients don't know how much pressure they need to put on that tray, and you don't want to leave it up to them to make sure that it's seated all the way. So what we're going to do now is the first type of impression we're going to take is putty. I love this putty. It's a great product. This is from Kulzer. I've been using this now for about 5 years, and I will tell you that I like using putty because I feel like I have more control than I do over a heavy body final impression material that runs a little bit more viscous. So let me show you how we do that. And it's very technique sensitive, but I will tell you, once you do it, you'll probably fall in love with this technique just like I have. And now almost all of my impressions are done with putty. So we're going to scoop out a scoop of each. We're going to mix it together. Notice I'm using nitrile gloves. I like to use gloves. These are cranberry nitrile gloves. Really good product. I'm going to knead it, fold it, really mix the material. You don't want to see any swirls. You know, you don't want to have two different colors here. This is purple and gray. We're going to keep rolling it, kneading it, folding it, moving pretty quickly because the hands are warm, so it's going to accelerate that setting time. So you want to get moving. I'm going to roll it into a hot dog. I'm going to lay it into the tray all the way around. And then what I'm going to do is kind of flatten it out, making sure nice and flat. I want enough material to kind of go up and over the tray edges just a little bit. And then what we're going to do is we're going to just kind of patten it down, and I'm going to go right in the mouth. Don't touch any of the teeth. Pull the lip up. You see how I've got that lip, and I'm going to push. This material is very thick, so I got to use a lot of force to push it in and make sure I'm getting all the teeth to go into that material. And notice where my hands are. I'm massaging her face. I'm holding it in the premolar area. I've got really good control of that tray. And what I'm going to do here is this is what's called the two-step technique, and it's a technique that I really like to use a lot because I have control. I can pull it, it's still soft. And you say, Shannon, but it's still soft. I know, because what I'm going to do now is I'm going to just maneuver the tray a little bit, and then I'm just going to make sure that I've got enough room where I can start with my light body wash. And this is correct flow wash. I'm going to start with the last molar and go all the way around. My impression is not coming from the putty. The putty is just a cushion. My impression is coming from the impression material. And notice I've got it about an inch wide of material. I'm going to seat that right back in where I was because I remembered where I had placed it. And again, if you're off a little bit, it's okay because my impression is coming from the correct flow wash, not from the putty itself. I'm right back where I am. I'm not moving around, and I am just going to hold that until it sets up. I love this technique. There's a lot of different techniques out there. There's one that's called the one step, which we have a video of that through YouTube as well, where you can make a trough and then just add the light body in it. But this one I like because if I take the impression of the putty and for some reason I didn't have enough material or the tray was too small, I can stop right there. But if I add that light body to it, it's first of all a lot of waste of material if it's bad, and most importantly, I might not capture everything and I can stop. So I love this. Great impression material. Yes, got a lot. I almost got our lungs in that one. But I'm going to get it, you know. But the great thing of putty is it doesn't run. It doesn't go down their throat. Yes, I'm adding the light body, but I can tell you that, you know, patients really don't mind it. And so making sure, though, what we see a lot of times with rejected impressions or impressions that are no good is we didn't use enough wash to capture landmarks. And you think about it this way, the light body's got to go on the facial and it's got to go on the lingual. The putty is not what we're using to get our impressions. It is the light body wash, okay? We have everything we need here, everything that we need to see. We've got our frenum, we've got the buccal frenum, we've got the full palate, we don't have any voids, we don't have any bubbles, we've got our hammer notch, we've got everything that the lab needs in order to make a really good model from this impression. And then the same for the lower. You know, we're going to mix up that putty, we're going to go in there, we're going to seat it. We'll also make sure that, you know, we've got a good mix of material. You know, notice that there's no swirls. We're going to mix that up, place it in the tray flat. We're going to seat it in the patient's mouth, push, 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 push. Count to 20. We're going to pull it. And if I feel like I didn't have enough putty, I may take that light body and go all the way around the tray. Start at the last molar. I'm going to go all the way around the last molar. And now I'm going to seat it, wait for the timer to set up, and I got a good impression again. These impressions can be poured multiple times. That is what's great. We did a study with Great Lakes Lab where we basically had to make some night guards for me. And so one of the things that we did is we wanted to make a night guard for every different type of night guard that they offered, and they offer several. So I want you to know that they only used one impression because they poured this multiple times to make this night guard. And it was amazing to see the detail, the longevity of these impressions. They can sit on a shelf for months, especially for a patient like me who's had surgery and had to have multiple provisionals made. This is a great product for that. I love that. Now let's talk now about the final impression technique, because it's something that we really need to focus on. When we think about control, we think about what are we needing. This is the most incredible final impression that I've ever seen. We captured all the dentition, you want to see that sharp, smooth margin all the way around every tooth. We have to have that. We can't ask the lab, oh, just see if you can find the margins, you know, or hey, you know, let us know, you know, just go ahead and, you know, if you need me to tell you where the margin is, I'll do it. Or if I need to even trim the dies, why not take it and do it right the first time? But we have to have good tissue management. The other thing that they offer is a scannable material. So if you have a scanner and you want to take the impression, just scan it digitally and then send the files to the lab, you can do that as well. And this is their Fast and Scan. There's a lot of great data on that. And as far as the precision, giving the lab the things that they need, it's another option if it's something that you're looking for in your practice. So again, going back to controlled hemostasis, whether you're packing cord, you've got a laser, you're using, you know, any type of maybe putty material or what we call putty hemostasis, it's really important that you think about what are you seeing. If you can't see the margins, how you expect to pick it up in the impression material? So we need to push that tissue out of the way to capture that. One of the things that we find is what there is called tissue interference. It's where the tissue is basically up and over the margin, so it makes it hard for the lab to see. So let's talk a little bit about the problems and the issue. You know, we see a lot of soft tissue that interferes with the areas, so this way we can't really fabricate a provisional restoration. It makes it tough. How do we find the resolution for that is really just utilizing retraction cord and thinking about, you know, how long it's going to sit there. A lot of times we'll leave that and he'll go check hygiene, or the doctor will go check hygiene while I'm placing the cord. I like to do a two-step cord technique, but I am a cord person. I do love packing cord, but I also know what it does for our impressions, and I am really big on this. I think that there's no compromise. It's great to have the lasers that we have out there, and we utilize those, but we still go back to cord. There's nothing any better. If you can train your assistant to pack cord for you, it's going to cut down a lot of time, so while the doctor goes and checks hygiene, I can do this. So I'll pack the first cord, then I'll come back and pack the second cord, and before we take the final impression, we're going to pull that. But I can tell you that there's lots of cords out there on the market and lots of hemostasis materials. I happen to like ultra dense cord. This is the Ultra Pack. I like to use the Ultra Packing instrument. So I can just roll that cord right into the sulcus. And there's all different sizes, but I can say that we like to do the double cord. So here's how we do it. We're going to place either a 0. We like to even use a 00 cord. We'll place it into some viscostat. It's a hemostasis material from Ultradent. I like to use viscostat clear, not anything that's colored. Ferric sulfate can sometimes stain, so I like to use the clear material that I like to soak it in. But again, viscostat clear. I'm going to cut my cord, soak them in it, let it suck it up, and then I'm going to place my cord all the way around, making sure that I've got it all the way around and tucked into the tissue. I don't want to pack it deep. One of the things that we know is it's not how deep you pack that cord, it's how the tissue can be pushed out of the way. So we're going to pack the first one. Now we're going to pack the second one, and we're going to be able to get a really good impression. Look, you can see every detail, every margin, and all of that is transpired over into our final impression. There's also retraction paste out there, and Dr. Cram actually is helping me with this video. We placed some Expasil, and it's a good product, but you cannot have subgingival margins. And if you do, you really need to pack cord. This is really for like veneers, maybe onlays, and it has to sit in the sulcus for a little bit longer. It's a hard material to rinse out, and that's one of the things that really makes it tough for me. So I always like to go back. It's a good product, but I like to go back to my cord because it's just tried and true, and I think that's just preference. But one of the things that you can do with the Expasil is drop it into really hot water, get it soft, and go around all the tissue and just push that right into the sulcus. But again, tough to rinse out and hard to get off. And that's really important because if you leave any of that residue behind, it's going to transpire into your final impression material. And so I want to make sure that I don't see that. Material appearances are really important, and making sure, again, we go back to all the areas that we talked about as far as the folds. You know, are we looking for, no tray shine through? We don't have any extensions. We don't see voids, bubbles, tears, rips. All those things can happen. But those things, as they happen, I want you to understand that they happen, but most importantly, I want to spend the last few minutes with you just going through how did it happen? Because if you don't understand the why, you're going to continue to do it and you're never going to know exactly how that happened. And I want to tell you how it happened, so this way you'll know that you made a mistake and how can you correct it. What are well-impressed models? Well, they come from good impressions. And when we think about defects in the impression material, one of the solutions to that is to not lift your tip. When you place that tip into the material, you want to go all the way around without lifting the tip, and you want to make sure that, because if you lift it and you don't stain the product, you're going to get a bubble, you're going to get a big void. The other thing is making sure that you're monitoring the time. If you don't monitor the time and you don't have a timer, everything in life is not short enough, right? We're always saying, oh God, so much time, so much time, so much time. But if we don't have a clock telling us where we are, we might pull it too soon. And that's the last thing that we want to do, is to pull it too soon to where it's still soft or it rips. The next thing I want to talk about is putting the cap back on. After you're finished with the impression and you have extra material left over, a lot of times we think, well, we're going to be more efficient by just putting a new tip on, putting it in the drawer, so we have that the next time we need to take our impressions and we're ready to go. But what we find is, and it's not me, this is not my information, this is the scientists behind the material, the ones that are making the product. They have said, Shannon, put the original cap back on. Because if you don't put the original cap back on, air is still going to get into this material and it can cause you to have voids and bubbles. And last but not least, keep with the same manufacturer. You can't use GC America's heavy body and Colzer's light body, or 3M's heavy body and Dentsupply's light body. These products are made to go together. So it's really important to make sure that when you're doing that, that you have the same product name brand, because they're made to go together. You can't substitute it. So let's talk about defects. Torn facial margins. Tears come from time. You didn't give it enough time. And here's what happens a lot is we'll start the timer the minute we place our heavy body material. Well, think about it. It's going to take time for us to place the heavy body material. If we start the timer then and we're not really thinking, how long did it take for us to put this light body wash into the sulcus? Really, ideally, the timer should start when the light body goes, not the heavy body. So keeping that timer, again, tears come from time. Check out the linguals of these impressions. When you look at these two, I see great facial margins, but this is not a veneer. These are crowns. We don't see the same detail, the same margins on the lingual. So this is really not a good impression. What would happen is you may have a defalsified margin for the lab to see it, and they're going to guess where does the end of that restoration go? Where are the margins, right? So it's really important to make sure that, again, we're controlling the tissue and we've got that tissue retracted so we can see that. And we need to use a good proper core technique for this impression. Here's another defect from tears. Again, going back to tears, using one type of product versus another, maybe not letting it set up long enough. And this is what we see probably the most, is what we call these little Nike swooshes. And I like to say Nike because of the way that it looks. When we think about a defect, which is really due, first of all, to the wrong size tray, okay? You can see the product, the impression material is hanging off the tray. So we really should have went up a size. I always try the tray in to make sure that it's the right size for the patient. And then also making sure that when we seat it, and I want you to think about this, is when we seat this impression, we have to make sure that we don't move the tray. If you don't see a crisp, clear margin and you see these little areas that almost look like EKGs, right? That did not come from the product. I've had people call me and say, Shannon, that product you told me about wasn't that good. I got these little areas. And I'll say, well, take a photo of it. Show me what it looks like. You moved. When you get that impression in the mouth, you got to be still. You cannot move around. And that's what you're going to get. And so those are from movement. That's operator error, not the product. And then the last one, which is a no-brainer. This one should be so easy for you to know why it's bad. These teeth cannot hang off of an impression tray. You say, oh, it's okay, it's the impression and we got all the detail. But the tray stabilizes the material. It makes it hard for the lab to be able to pour this up. And what if we got to articulate this model? What if we're prepping a full arch? They need to see that, but the tray is too small. The tray has to fit and support the product. It has to fit and support the material that captures all the landmarks. And so this tray is too small. It's got to fit the patient's mouth. I want to thank you so much for your time today. It's really important for us to make sure that you understand not only the impression materials that you use and the procedures to help you be more efficient, but most importantly, what am I looking at? Why was it bad and what can I do better as a clinician? I think that those are the things that we really want to help you with the most. And we have a lot of guides on our website, a lot of things that we can go back to help you and your team be really successful with the art of impression taking. I'm Shannon Brinker, and I want to thank you on behalf of Colzer and Contemporary Product Solutions today in the Academy of Chairside Assisting. And we look forward to seeing you again in another one of our modules.